See, I'm not going to lie. Visceral fat, or what we call belly fat, is very difficult to lose. Okay, and the problem is not just that it's very difficult to lose. The problem is that it puts you at risk of certain conditions like diabetes, heart diseases, metabolic diseases, and certain chronic conditions. Okay, but doctor, you've told us about the fact that visceral fat can put us at risk of certain conditions. How then do we lose belly fat? Now, here are some ways to lose belly fat without using drugs. Number one, please manage stress. First of all, when you are stressed, stress causes your body to release a particular hormone called cortisol, and cortisol is a stress hormone. This cortisol tends to cause your body to gain a lot of abdominal fat. It can also increase your appetite for food. And so, as much as possible, when you are trying to lose weight, please try and manage your stress. Of course, you cannot deal away with stress because stress is part of life, so long as you are alive. Please deal with stress. You don't joke with your sleep. Don't go around saying that sleep is for the weak. We've heard. Number two, excess intake of sugar. You know that kind of drink that when you pour in a cup, then it's doing, or when you drink, it's like something is doing you. Yeah, I mean, let's not play the ostrich. I know some of you are watching me right now are addicted to that drink. Please, research has shown that excess intake of sugar can cause heart disease, obesity, fatty liver disease, type 2 diabetes. Please reduce amount of sugar intake. Why? Because when you take in a lot of sugar, the body will use what it can use. Some is stored in the liver, and the excess amount of sugar is converted to fat and stored underneath your skin. So, please, if you have not yet subscribed, I beg you, hit the subscribe button. We go through a lot making these videos. Just subscribe. What is your problem? Please hit the subscribe button and hit the like button, and kindly share this video. Number three, exercise. Well, I know some of you may not like this one, but I'm sorry. But how else do you want to lose your belly fat? See, when you exercise regularly, what your body does is that it forces your body to mobilize the fat. So you see, it goes to where the fat is, especially your abdomen, okay, and tends to break it down. That's when we say you are burning calories. You are burning calories, okay? So if you have a gym close to your area, please go there and register and be diligent. However, if you cannot afford, get a skipping rope, skip for 30 minutes at home. Please exercise to lose your belly fat. Number four, please reduce the amount of fatty food intake. And for some of you, I know that since the day you were born, you've been taking a lot of fatty. I understand, I get it. And I know it's difficult, but please, in moderation. The amount of fatty food you've been taking, please take it in moderation. Bra, Charles, Quay, Domedo, please reduce the amount of fatty food intake if you want to lose belly fat. You cannot be exercising and you are still taking an excessive amount of fatty food. Please, it's 2-6 and loss. You are just wasting your time. Please reduce the amount of fatty food intake. Number five, see if you're a member of the Ghana Drinkers Association. Please, you've done well. You've been in the group for long. It's time for you to leave the group. See, because excessive amount of alcohol intake has been linked to central obesity. See, that's obesity around your stomach. Okay, because there's no safe level of alcohol intake. If you drink alcohol and want to lose belly fat, it's very difficult. So please, if you want to lose belly fat and you drink a lot of alcohol, please, if you cannot stop, just reduce it. Reduce it, but I would advise that you stop taking alcohol. Number six, you can try fasting. I know this one is a very dicey one, but it's been shown to be very effective, especially what we call intermittent fasting, where you eat all your food within the first 8 hours and then the rest of the 16 hours, no food. However, if you want to commence this practice, I would advise that you see your doctor, because there are some people who have peptic ulcer disease, and commencing this practice can give you a lot of problems. There are other people too who might want to eat a lot after breaking their fast. And so, since we are trying to lose belly fat, we don't want this practice to be counterproductive. And so we need to see your doctor if you want to try fasting to lose belly fat. But it's been shown to be very effective. And please, if you have tried all these methods and it's still not working, you need to see your doctor and your dietitian. And please, you need to understand that it's not only fat that can cause a very big abdomen, okay? I mean, sometimes it could be a growth for women, it could be something like a fibroid, or maybe there could be a fluid developing in your stomach, okay? So you need to see your doctor if all these things are not working, all right? So you've been going to the gym, lifting a lot of weight, yet your abdomen keeps increasing. Please, you need to see your doctor. Kindly like, share, and subscribe to my YouTube channel. Kindly share this video to your loved ones. I'll see you in the next video. Bye bye.